problem.
Okay. Hi, I'm Dawn Hatanaka, Executive Director of Obesity Canada. And 2022 was an important year for Obesity Canada as we laid the groundwork for an integrated approach to obesity care in Canada and worked towards delivering our vision, a day when people affected by this disease are understood, respected, and living their healthiest lives. In a moment, you're going to hear about what we achieved this year and what's in store for 2023. Obesity Canada is a registered charity that relies on personal donations, support from our corporate and nonprofit partners, and government project grants to do our work. On behalf of our board of directors and staff, I want to thank all of our members, volunteers, donors, and supporters for their commitment to improving the lives of Canadians with obesity through research, education, and advocacy. Together, we are making a difference. And now it's my pleasure to introduce our scientific director, Dr. Mary Forhan, for an update on Obesity Canada's impact.
Thank you so much, Dawn. Thank you, Dawn. It's a pleasure to be here. I'm Dr. Mary Forhan. I'm the Scientific Director of Obesity Canada. I'm just going to turn off my video so that you don't have to watch me talk through what I hope you'll find a very interesting update of the past year with Obesity Canada. So I've been working in obesity research and advocacy since 2006, coinciding with contributing to the launch of the Canadian Obesity Network in 2007, which then became Obesity Canada in 2018. I'm thrilled to be here today as Scientific Director to acknowledge that although significant work remains to be done in order to realize Obesity Canada's vision, we have made tremendous progress over the years. 2022 will stand out as the year that Obesity Canada reaffirmed its deep commitment to Canadians living with obesity and the healthcare, research, and policy communities who serve them. We've retooled and realigned our resources to become more collaborative with our stakeholders, more strategic in the way we identify priorities, and innovative in the way we propose and design solutions. Obesity Canada is fundamentally a science-based organization, meaning that everything we do seeks to produce and or capitalize on the best available evidence when it comes to addressing deeply ingrained weight bias and stigma, enabling policymakers, researchers, and healthcare professionals to understand obesity and put evidence into practice, and advocating for access to evidence-based obesity treatments and supports for all Canadians who need them. To do that, Obesity Canada works within 3 priority pillars that drive our progress within the 3 strategic focus areas. And so I'll frame this update and around our activities within these pillars in 2022 and what's to come in the near future. Obesity Canada's overarching goal is to create a national obesity care framework based on our landmark adult obesity clinical practice guidelines, which we published in partnership with the Canadian Association of Bariatric Physicians and Surgeons in 2020. Although science tells us that obesity is a chronic disease in the same way diabetes and heart disease are, Canada's health systems don't include obesity within their chronic disease management frameworks. That means that Canadians living with obesity typically don't receive the care they deserve and that their disease requires. They face long wait times for treatment, such as bariatric surgery, and often have to pay out of pocket for other treatments. This is the core inequity Obesity Canada is working to change, and the CPGs, or Canadian Practice Guidelines, as a living database on obesity evidence are foundational to our work. Integrating the CPG recommendations into an obesity care framework that can be confidently and efficiently adopted by healthcare systems to design obesity care services is now our challenge. But there are a lot of unknowns that we need to shed light on before this can become a reality in Canada. So I'm going to give you a research update here. And on that note, we're going to take a look at how Obesity Canada has been working towards putting the CPGs into action. As I mentioned, the recommendations in the clinical practice guidelines have significant implications for people living with obesity, for the research and healthcare communities, for obesity policymakers, and for the ways that Obesity Canada can educate and integrate all of these communities. To that end, we've created 4 action teams. These are small working groups of leading researchers and graduate students, healthcare professionals, and people with lived experiences who prioritize and conduct strategic initiative designed to answer key questions and identify important knowledge gaps related to developing an obesity care framework rooted in the CPGs. The goal of each team is to produce annual high-impact intelligence while also fostering new collaborations that otherwise might not have happened, just sort of out in the wild or naturally, and an opportunity to do publishable and impactful work. The outputs of each project, in turn, will inform all of Obesity Canada's activities moving forward. Tenure on each team is about 1 year, or until a project is completed, at which time Obesity Canada will release a call for applications for the next membership on our action teams. And then they will work to identify the next project and building on the work of the previous team. And this is a way of us to build in sustainability and capacity building within our 4 pillars. So new action teams that we have installed this year is here you can see that what each team is working on for 2022 to 2023. We are thrilled with the reaction to our initial call for applications and the passion and creativity that we've seen this year. We have nearly 40 team members in all, and they've come from 13 universities across Canada, as well as professional associations, health NGOs, patient advocacy groups, and clinical practice. These are critical communities that can support OC's work toward a national obesity care framework, and we are expecting really meaningful and actionable results from this inaugural round. All of these projects will result in the identification and prioritization of future OC initiatives, all designed to implement the CPGs into research, education, and public policy. For example, the federal, provincial, and territorial environmental government policy can inform future initiatives to integrate the CPGs into existing obesity prevention and management policies. The education mapping exercise will inform future strategies to integrate the CPGs into medical school curricula, and that's just one example. The research agenda can help us address research gaps identified in the CPGs to continue to build the evidence base needed for a national obesity care framework. And the National Patient Survey, these results can help us identify strategies to integrate the obesity CPGs into other chronic disease clinical pathways so that patients living with obesity-related chronic diseases can receive the care that they need and deserve. So when we talk about the CPGs, these were conceived as a living database of obesity care evidence and best practices. And of course, that means that they will need to be updated as new evidence emerges. Our CPG Update Committee prioritizes updates based on input from chapter authors who are experts in their field. In 2022, authors of 2 key chapters, the medical nutrition therapy and pharmacotherapy chapters, felt that there was enough new publications to warrant an update to these chapters. Authors updated evidence currently in the nutrition chapter recommendations involving the use of partial meal replacements, as well as intermittent fasting. The pharmacology chapter updated recommendations include a 4th medication now approved for obesity management by Health Canada. They also added some new recommendations based on patient-oriented outcomes that move beyond weight loss, and created new sections that discuss the effect of obesity medications on cravings and quality of life. Both of these chapter updates use the same methodology as the original guidelines, which involved the engagement of an independent methods team at McMaster Evidence Review and Synthesis, as well as the use of GRADE guidelines development framework. The McMaster Evidence Review Synthesis you may also know as MRST. Anyone who has worked on CPG development knows that they are major undertakings and only reliable when they are up to date. Our authors did a great job of updating these critical chapters. As a reminder, none of the chapter authors receive remuneration for their work. We are also thankful for the hundreds of volunteer hours dedicated to guideline updates by obesity experts in Canada. Speaking of CPGs and major undertakings, 2 international adaptations of the Canadian adult CPGs were completed and published in 2022. When our CPGs were published in 2020, we saw strong interest from organizations and individuals working outside of Canada who asked how they could use the guideline to improve obesity care in their own country. In partnership with the European Association for the Study of Obesity, Obesity Canada launched a pilot project in 2021 to see if the Canadian guideline could be used as a foundation upon which to build country-specific obesity care recommendations. Adaptations of guidelines in other disease areas is common, but this is the first time that an obesity clinical practice guideline has even been updated. Coalitions of national and regional organizations responsible for obesity in both Ireland and Chile were selected based on strong demonstrations of the need to improve obesity care and their ability to organize and support the adaptation process and disseminate the guidelines. Each nation used the same evidence-based grade framework, and when we say grade, it's capital G, capital R, capital A, capital D, and capital E framework as the Canadian CPGs to assess country-specific evidence while adjusting for differences in healthcare delivery models, availability of specific treatments and supports, and unique population and sociocultural characteristics. Through this pilot project, we concluded that the Canadian CPGs can indeed be updated for different health systems and populations while maintaining their overall vision and key messages and key principles. So just to review here, Ireland published their adaptation in October of this year, followed by Chile in November. And so you might wonder how it benefits Obesity Canada or Canada to have our CPGs updated internationally. The Canadian guidelines took significant time and resources to produce. We estimate that the Canadian CPGs cost well over $1 million in both cash and in-kind contributions, such as the thousands of volunteer hours from more than 60 authors over nearly 4 years. This puts the creation of the CPGs with the same scope out of reach for many other countries. However, Chile and Ireland were able to produce their guidelines in only 1 year. It took Obesity Canada and the Canadian Association of Bariatric Physicians and Surgeons nearly 4 years. As well, Chile and Ireland were able to develop and launch their CPGs at a cost of approximately $250,000 US. This is about 1/4 of the cost for the original Canadian CPGs. More importantly, the world now has a coalition of more than 200 CPG authors and 14 participating scientific and professional associations who are united in promoting evidence-based and person-centered obesity care, as well as established methods to adapt obesity Canadian practice guidelines, new research questions for all nations to use in the future CPG updates, and more, and also many, many more opportunities. This coalition of like-minded, activated experts and organizations will only grow as more countries adapt the Canadian practice guidelines, creating opportunities to share implementation insights while reducing the duplication of effort and making this a more efficient process. Obesity Canada will collaborate with these individuals and organizations going forward to leverage resources in healthcare, professional education, policy development, patient engagement, and support, advocacy, and much more. Of course, adult Canadian practice guidelines are only part of the engine that will drive a national obesity care framework. Obesity Canada is proud to support the development of updated pediatric guidelines, the first update in more than a decade. Led by a blue-chip team of pediatric experts, these guidelines will include recommendations to establish core competencies among healthcare professionals to optimize patient and family-centered care while informing the development of evidence-based health services and policies that serve this population. 5 systematic reviews of key topics and a survey of parents about their desired treatment outcomes will be used to craft the CPGs. This year, the steering committee, working together with national and provincial organizations, published the research protocol used to develop the pediatric CPGs. This is a very important publication as it provides a transparent outline of the entire guideline development process, both in terms of the evidence review and the engagement of caregivers of children with obesity. The Pediatric Guideline Group also published the results of a stakeholder survey, which included caregivers of children with obesity and the CPG steering committee members. The stakeholder survey was designed to identify and prioritize key health indicators that would inform data reporting and the interpretation of the CPGs. Another key project to help build the evidence base in the integration of the CPGs into a national obesity care framework is a unique patient survey developed by the Community Action Team, along with our market research partners at Ledger. This is a great early example of innovation from one of our action teams. The survey is designed to understand the experiences of Canadians living with obesity and other obesity-related chronic diseases who are counseled to lose weight by healthcare professionals who are not obesity specialists, and as a way to improve obesity-related chronic conditions. We know that obesity management is important for preventing and managing many chronic diseases, but we don't know the nature or quality of the advice or obesity treatments that are being provided to patients in these settings. This research will add more insights learned from Obesity Canada's previous report cards on access to obesity care and highlight areas where work will need to be done to ensure obesity care is in line with the CPGs, perhaps future work for an action team. The survey has been in the field for a couple of months and has just closed. We cannot wait to see what the data is that comes back as a result of this survey. One final note on the research front, Obesity Canada continues to be a leading knowledge translation partner for research in Canada, especially for patient-centered research projects. A couple of highlights from 2022 are listed here. We've got CHR conversation cards for moms. This is a mixed methods study to create and evaluate a new clinical tool for use in maternity care settings. We also have a Women and Children's Health Research Institute addressing caregiver burden and stress in genetic obesity conditions. And of course, we will look forward to the outputs from the action teams, especially the research action team, which is working to inform a new obesity research and KT agenda, so that's a knowledge translation agenda in Canada, in tandem with our research partners across the country. Check out our KT page for more information on how to partner with Obesity Canada. There's lots of great information on our website. So we've got some excellent education updates from this past year as well. Translating knowledge to change clinical practice is the second of OC's 3 priority areas and is something that the organization has excelled at since day one. Like many organizations, Obesity Canada was forced to pivot away from successful in-person conferences and workshops during the pandemic, which represented a dual challenge of how to meaningfully engage our audiences while also having ramifications for events revenue to reinvest into OC's operations. Updating our education offerings to be in line with the CPGs was another significant undertaking that lasted well into 2022. I'm so pleased to report that the OC team managed to meet these challenges head on and make significant progress in our education stream. First up, we launched a new education pathway via a new online portal this year that will allow easy one-step registration and access to all of Obesity Canada's online education offerings. These will be created and tailored as needed as the CPGs are updated and in line with our education action team projects as they identify priorities and opportunities. A free Introduction to Obesity course for healthcare professionals was launched, with a free course for patients coming soon. The Certified Bariatric Educator designation exam for both Canadian and international healthcare professionals was brought into the portal and updated to reflect the CPGs. We expect to add in our Advancing Obesity Management program soon. And a brand new online course for physicians, Caliber, was created as part of the International CPG Adaptation Program and in collaboration with the European Association for the Study of Obesity. Caliber was developed over the past year by leading national and global obesity researchers and clinicians, many of whom co-authored our CPGs. It's a highly accredited program for physicians and allied healthcare professionals that involves a combination of online reading and video presentations, as well as 3 live interactive workshop sessions, these covering all aspects of person-centered obesity care. Our first 2 cohorts of 50 participants in 2022 sold out, and early feedback is overwhelmingly positive. So more big news is our return to live knowledge translation events with our flagship Canadian Obesity Summit, taking place in Whistler in May 2023. Work on the program began in earnest several months ago, and we've had 2 calls for abstracts to date, with a great response from both. I can assure you we have a full and exciting program. The summit is a unique collegial event that brings together professional obesity stakeholders and the wider obesity prevention and treatment community for a collegial, engaging learning experience in a great setting. It features workshops, research updates, plenary sessions, and more on every facet of obesity prevention and treatment. Obesity Canada's action teams will also meet at the summit to discuss integration of their work and future direction towards building the National Obesity Care Framework to inspire future action team members and to guide Obesity Canada's activities beyond 2023. If you've been to a summit, you know how unique it can be. And if you haven't, you need to find out. So I hope I'll see all of you there. Registration is open. You can find a link on this presentation, I believe. If not, certainly go to the Obesity Canada website at obesitycanada.ca, and you'll be able to find on our banner a link to registering for the website. And as we have updates to the program, those will be available as well. So in 2022, Obesity Canada also partnered with researchers in the field of diabetes and cardiometabolic health to develop an integrative training platform for the next generation of scientists. The My Road training program has received a 6-year grant from the Canadian Institutes of Health Research. Through this program, Obesity Canada will take a leadership role in integrating patient-lived experiences into training programs for research trainees. Obesity Canada is a leader in engaging in patient-oriented health research and knowledge translation. We will leverage our expertise to support training in diabetes and cardiometabolic research areas, ensuring that patients can participate meaningfully in health research activities. We also hope to build capacity among future researchers to be able to engage in patient-oriented health research in an effort to align future health research with patients' needs and realities. The third pillar in Obesity Canada's strategic plan is to shape and inform public policy to legally, medically, and socially establish obesity as a disease in Canada. Obesity Canada's advocacy strategy involves 1. Building the evidence base to shape and influence policy. 2. Disseminating evidence to advance strategic policy areas. 3. Participating actively and meaningfully in policy forums to include obesity evidence and patient-lived experiences, as well to establish consensus. And finally, 4. Creating partnerships and communities of practice across sectors and disease areas. In 2022, we focused on leveraging the evidence base from the CPGs into international, national, provincial, and local policy forums. Obesity Canada participated in the National Dialogue to inform the National Framework for Diabetes, hosted by the Centre for Dialogue at Simon Fraser University. Obesity Canada also became a member of the Framework for Diabetes in Canada, External's advisory group on diabetes. We also continue to work with our members to influence policy change at provincial and territorial professional associations. For example, in 2022, medical associations in British Columbia, Alberta, New Brunswick, and Newfoundland and Labrador officially recognized obesity as a chronic disease. Our advocacy work also contributes to the elimination of weight bias, stigma, and discrimination in public policy. In 2022, Obesity Canada co-chaired a working group on weight stigma hosted by the World Obesity Federation. Obesity Canada is an international leader in weight bias, stigma, and discrimination research. And through this international working group, we worked with 39 experts and advocates from 18 countries representing healthcare professionals, policymakers, youth advocates, and individuals with lived experiences to develop consensus on recommendations for a global effort to reduce weight stigma. This consensus paper has been submitted for publication. Obesity Canada has been working with the World Obesity Federation to advocate for comprehensive global action. Ahead of the 75th World Health Assembly hosted by the World Health Organization, World Obesity put forward their members the endorsement of the World Health Organization recommendations on obesity and the World Health Organization's acceleration plan to support implementation. In 2022, Obesity Canada participated in a side event hosted by the World Obesity Federation during the United Nations General Assembly in New York City. Another international advocacy effort involves Obesity Canada's participation and engagement with the Obesity Society, which is the North American regional representative within the World Obesity Federation. Together with the Obesity Society, Canada, the United States, and Mexico are aiming to strengthen research ties. Obesity Canada has a representative on the Obesity Society Council and participates in its annual scientific meeting. Obesity Canada also disseminated the CPGs to benefit plan providers to change the way obesity is viewed and treated by private benefit plan providers and health insurance companies. In 2022, through the support of our focus partners, Desjardins Insurance, and the Obesity Canada team presented key messages from the CPGs for benefit plan providers who attended the annual Chronic Disease at Work conference. Obesity Canada continues to prioritize activities to empower patients to stand up for their rights and to participate in policy influencing activities. Through the OC Connected Conversations, hosted by Lisa Schaefer and Ian Patton, we aim to bring together academics, health professionals, and individuals living with obesity for meaningful discussions that will bridge the gap between science and real-world application. The OC Connect online patient community has continued to grow and has been an important research for advocacy. In 2022, we launched the Advocacy 101 course with OC Connect for individuals living with obesity who are interested in advocating for themselves and for their families. This course will help us educate and empower members of our community and enable them to get more involved with OC advocacy efforts. To help people living with obesity access evidence-based obesity care, Obesity Canada also relaunched the Obesity Care Finder. This resource can help Canadians living with obesity find healthcare professionals for clinics in their local communities. A key strength of this resource is that healthcare professionals and clinics listed in this Obesity Care Finder have demonstrated some level of obesity management training and certification. Obesity Canada has also collaborated with the US-based Obesity Action Coalition to help the film director and lead actor from the movie The Whale understand the perspective of obesity advocates by sharing the lived experiences of obesity. Obesity Canada also attended the film premiere at the Toronto International Film Festival. In 2022, Obesity Canada continued to build partnerships with other NGOs and professional associations through the Canadian Obesity Advocacy Network, or CONE. CONE members continue to advocate to change the obesity narrative by sharing education and resources for people living with obesity, policymakers, and healthcare professionals. In addition, CONE members help advocate for obesity by providing endorsement for the Canadian CPGs, which will help change the narrative of obesity and support that one voice on obesity, both nationally and internationally. And there's a great example of what organizations working in obesity-related spaces can do to mobilize the CPGs within their own work. The University of Ottawa Cardiac Rehabilitation Program developed a pilot project to implement the Canadian CPGs into their department. Stay tuned for key results and resources that come out of this project. This project represents a great example of how the CPGs can be integrated into practice at a hospital level. All of these activities that I've described and more will lead to some significant deliverables in 2023. We anticipate a lot of attention and interest in the results of the action team's projects, most of which should be submitted for publication within the next year. A great turnout to the summit, several cohorts of caliber and other education programs, and of course the launch of the Pediatric Canadian practice guidelines or clinical practice guidelines, and the patient survey, both of which will be accompanied by PR pushes and KT work. It all adds up to maximizing Obesity Canada's impact, integrating knowledge created within the network and outside of it, building partnerships and collaboration, all in a constant feedback loop that keeps us laser focused on where and how we can act to create change. Canadians living with obesity have been waiting too long to be respected and supported, so our mission to create a national obesity care framework is critical, and it can't happen soon enough. Overall, it has been a challenging but innovative and productive 2022 for Obesity Canada, which will no doubt give way to an exciting 2023. Over the coming months and years, Obesity Canada looks forward to working with people from across Canada to lay a solid foundation for a national obesity care framework that is truly person-centered, evidence-based, and comprehensive in scope. There is growing momentum for change, and Obesity Canada is at the forefront. By leveraging partnerships in Canada and abroad, co-creating knowledge and translating it into practical solutions, we see a brighter future ahead for people living with obesity. On that note, I'd like to thank the sponsors and partners you see listed here for making all of this possible in 2022. Thank you so much for your time. Learn more about what we do and how to collaborate with us at obesitycanada.ca.